that we get from the state is really our data that we're getting, our important data is coming through Chief Kaufmann's office, and he's able to sort and show specifically what zip codes these COVID cases are occurring in, so we can break it down to what the numbers are in the Slidell zip codes, the 4 Slidell zip codes, and then look at that as a percentage of what's going on in the parish. And we have seen in the past 2 weeks, the numbers are starting to inch upwards. We've had good numbers in our hospitals. Over a month now, we've had single-digit cases of COVID in both of our hospitals, North Shore and SMH, and that would be in the med-surg beds as well as the ICU beds. At one point, we had nobody on vents. Every now and again, past couple of weeks, we had 1 or 2 at a time on vents in the ICUs, but really looking very good for the community until the past couple of weeks. I know I talked to the folks in the hospital today. We have 12 patients in both hospitals in Slidell with COVID right now. One of those individuals is on a ventilator. So we're not stressing our healthcare system yet, but with the direction the curve is going, there's a concern that in the future we may start to stress the healthcare and the hospital delivery system. People in Slidell, we've been doing videos, we've been doing outreach, we've been trying to let our community know from our Team Slidell perspective, Slidell Police, Slidell Fire, City Hall, and SMH Auctioneer. We call ourselves Team Slidell. We've been trying to give people information to help them understand the situation in Slidell with COVID, help them understand the mechanisms that are available to protect yourself, as well as to be socially protective of those that are around you, and ensure that you don't infect your elderly neighbors or friends or family, or infect somebody that's sitting next to you at a baseball game, say. With the numbers inclining and going up, the governor's edict to wear masks, we've done another video. We'll be doing another one this week, and probably we'll get Cromer involved with us to do it. The idea will be to give people enough information to make informed decisions about their health care and the way they do business in the community. I don't agree or disagree with the mask mandate, but what I do not intend to do is become a nanny state here in Slidell. I'm not going to go out and walk the streets and tell people you got to wear a mask. But I'm hoping that if we give them enough information, they'll make a decision that they'll feel concerned enough about those around them, not necessarily themselves, but those that are around them, to wear a mask. I went in a restaurant the other day, and an individual that I don't think he knew who I was, but he said, "Man, why are you wearing a mask? You're like the rest of the sheep." And I just looked at him, and I could have been offended, but I wasn't. I looked at it as a teaching moment, and I said, "Do you know where I've been?" And he says, "No, what has that got to do with it?" I said, "Well, I know where I've been and who I've seen and talked to. I'm wearing this mask for you, not for me. You better thank me for it." And walked off, and left it at that. He's scratching his head and thinking, what is this guy just, presented me with? So I don't begrudge anybody that feels that they don't need to wear a mask or don't want to wear a mask. That's your personal choice. The governor says you must. Here in Slidell, we're going to work with you. Our PD's not going to go around and tell people you got to wear masks. Our business owners are going to make a decision whether or not they serve you if you've got a mask or not. We're not going to be a nanny state, but I highly advise people to protect themselves and protect those around them. If we all wore masks, 80% of the folks in the community, would that stop COVID in our community? Some of the studies indicate that it will. I would like to think that if we tried it for 2 weeks and we made that turn, that we would continue to do it for another 2 and maybe wipe this out in the community. But what we're doing right now is definitely not working. We know the cases are going up. Now the tests are going up also, but if you look at the percentage of positives of the testing, they are starting to show us very slight incline also, which means that more people on average are being tested positive than were before.
All right.
Chris, if you give us some statistics. You got the information with that.
And I will, and I had some data from this morning's meeting, and the mayor and I will be on a hospital meeting at noon today. But I can tell you today, and we have a few more cases, Mayor, since yesterday at the hospitals, and we only have, I think, 5 total on vents parish-wide, 2 on the east side, 3 on the west. Both of them are in double digits, as the mayor talked about in some previous interviews we've done. We were in single digits for a long time, and we're concerned about the spike. You know, we're hoping to slow down the increase. We have to look at a long-term recovery plan until we get a vaccine. And not only do we have the COVID crisis, we have an economic crisis that we're in the middle of as well, and we're trying to balance that risk. Amazingly, the April data tells us the median age of a COVID-infected patient was 79. Today, it's 54. And we are seeing some more cases in female versus male. The reports I get from LDH are telling me today that it's not nursing homes or clusters. We are experiencing community spread, and we're experiencing more cases that are multiple cases under one roof. What that means is we've had somebody go out and bring it back home, which has been our concern. The asymptomatic person has no signs. It's somebody that can transfer the virus. We have to continue to stress to avoid large gatherings. If you wear a mask or mask up, use sanitizer, cough in your elbow, and when you're not around people, you don't have to wear the mask in public. So those things, if we think if we practice that and become the new norm until we have a vaccine or better data, that's the only thing we have control over.
Let's do this. Real quick, because we're talking to Fire Chief Chris Kaufmann. I wanted to make sure we introduce who's that voice is. We've got Slidell Mayor Greg Cromer, who are also joining me by way of video here on the radio as well. I want to take a quick break. I think we're going to get the police chief in as well. He's waiting to join the group, and we'll continue the conversation right after this.
Well, we feel that's safe.
Yeah, yes. Just from a testing standpoint, in April, we didn't have many tests that were happening. We were waiting on test data. Well, now we're testing right under 1,000, roughly 975 per day in St. Tammany Parish. And we have a roughly 10% positive rate. We're experiencing more people in a community with positive tests than we had early on. Obviously, more testing is going to give you more results. However, what we're saying today is we have more people we know that's positive. The cases appear to not be as severe. And obviously the age group is a broad age group today compared to what we had in April. So a lot of the data is telling us, you know, we're doing the contact tracing as much as possible. But as far as the overall testing, it's roughly 1,000 a day in St. Tammany Parish.
Wow. Now, real quick, I'm curious about results as far as how quickly those results are coming back. I know in a situation that hit pretty close to home, my daughter's boyfriend came to visit, and his roommate tested positive while he was visiting in our neighborhood. So we had him tested immediately. It took a minute to get those results back. Do you have a sense of that?
Yes, the results anywhere from 12 to 36 hours, but the average has been a 24-hour turnaround, and they do it electronically. They have a portal you'll go into, and if you're negative, you'll see your name pop up as a negative. If it's a positive test, the hospitals or testing facilities will call you and tell you that you're positive. And of course, at that point, give you some direction to quarantine.
All right. And I want to bring the police chief in too. We've got Randy Fandal here. And so I'm curious, we were talking off the air about this process and how it's gone on. Give me kind of your sense of where we are and how the public seems to be responding as far as the mask mandate and so forth.
Up until this point, public, we didn't have any problems at all with the recent governor's proclamation. we're starting to get a few calls about people not wearing masks inside the stores. What we're telling people is the store management has the right to refuse your service. So he can call us and ask us to remove somebody from their store. But as far as enforcement on the mask itself, we're not enforcing any mask regulations.
Let me ask you this, and I'll ask this to any of the three of you, but the masks, as we talk about them, in my mind, are in a sense pro-business. And by that, I mean, I think we all want the same thing. We want this done. We want to get this out of here and get back to our normal lives. So mask, as far as businesses go, it is their prerogative. My question is, what business owner at this point would be against it if we're trying to get this done and we believe that's the way to get it done? Anybody want to jump in on that and tell me what you think? Go ahead, Chris.
I think it's paramount at this point. As I stated, we in a COVID crisis, but we also at the same time in an economic crisis. And part of our plan from the beginning was this phasing plan to reopen was to give our public the sense of being safe to go out and get our businesses back in operation. And they need to have that feeling that it's safe and everybody's taking every necessary precaution. And we are self-policing. What I mean by that, we're expecting the business owner or manager to really enforce the declaration. And this is critical for our economy going forward. And I would ask the people that may not believe in the mask or would like to be infected to get it over with, whatever their reasons may be, look at the big picture, what's in the best interest of the majority, the greater good for the majority, and mask up so that we can move forward. This is a long-term recovery. It's not going to be a fast process. We don't have a vaccine. And the only way we're going to be able to continue to support our business is to do it as safely as we can so that people feel comfortable to go back in. And that has to be the message. Somebody that's deaf or has respiratory problems, we understand that. There's a small percentage of those individuals, and that would be the first thing that I would say, that they have to at least disclose that. But the majority of the people should be able to comply and not get to an enforcement criteria that has to be really put in place.
Just while I got your mic hot real quick, because I know mental health issues are a big part of what you do as well. That's a pet project for you. So what are you hearing in terms of how people are dealing with this? I know there's a lot of frustration. I could see where, people that previously may have been predisposed to having issues, this would only amplify those.
Yes, I mean, all the data that we've been tracking in the Slidell zip codes, and our mayor's been doing a great job bringing us together, getting the message out to our public. But part of the data that jumped out at us, and I have a management team behind me that's breaking this out, whether it's LDH or local data. We want to know what's happening here in our community. And we've seen a spike in overdoses. My first report was March to June 20th was 42 overdoses. I've now expanded that to July 13th. We're now at 47 overdoses, and we've administered Narcan 35 times. We have brought many of these people back to life. When I look at those cases, it has a mental health foundation. We've had several suicide attempts, so we've had several people commit suicide. So we were concerned with the crisis in the beginning, being quarantined, and it's part of our plan to reopen, get people out of their homes. But there is a mental health component we have to be concerned with. It appears to be a little higher on the east side of our parish than the west. Our suicide rate is not up above last year at this time, but we are seeing the cases rise. However, the overdose comparison is off the charts. It's 7 times what it was at this time last year.
Wow. All right. Mayor, I'd like to get you to jump back in here if you can. We're talking to the guys from Slidell. This is Mayor Greg Cromer about to speak. And I know you're a pretty positive guy, and you're a big proponent of putting your best foot forward. I'm going to let you kind of wrap this up. We're almost out of time. What would you like to close with?
Yeah, Charlie, the message that we have here is let's slow the pace, cover your face. The bottom line, though, is government is not going to fix this. It's going to be fixed by each individual taking the precautions necessary to protect themselves and to protect their families, personal responsibility and social responsibility. If you keep your distance, social distance, whenever possible. If not possible, cover your face so that you're not exposing those around you to whatever you may be carrying, and because you may be an asymptomatic carrier. Coughing into your elbow when that occurs. Avoiding crowds at this time, until we get this peak going down, let's avoid crowds. That doesn't say, I'm not saying don't go out and shop, don't go out to restaurants, but go out and be diligent with what you do. If you got to go shop, go hit 2 or 3 places that you've got to be and get back to your home, and maybe don't go back out for shopping again for 2 or 3 days. Support our local businesses, support our local restaurants. If we have to go into a phase 1 again, if the governor would move us into that and businesses would be forced to close again, we would lose a lot of our small mom and pop businesses, which are the heart and soul of our community, number one, the core of our business community. We cannot afford to go back into that direction. And I will argue with the governor to go into phase 1 again. I do not want to see that happen. But we have to not rely on government to fix this. It's going to be fixed with each individual making a commitment to do what's necessary to protect themselves and protect those around them.
All right. Anything else I should have asked, gentlemen, before I let you go? Have we covered everything you wanted to cover?
I think the mayor's message is great. I would add at-risk people have to stay home. Those are the people that have underlying medical conditions. That's number one, so we can keep the death rate down. And yes, take ownership, and let's do what we have to do as a community to go forward. Today, we think we have the health part of this at least under control, but we need to get this economic challenge under control, and we only can do that individually doing the right thing.
All right. They represent the city of Slidell, Chief Fandal, Chief Kaufmann, the mayor, Greg Cromer. We appreciate you gentlemen sharing a little time with us today, and thank you for the work that you're doing on behalf of the citizens of Slidell.
Thanks, Charles.